everyone, my name is Avery.
And I'm Allie, and this is my horse Sunny Smoky Mountain. And today we're going to be talking a little bit about twitches and restraints, but first I wanted to give you a little bit of history on Sunny. He is a 22-year-old gelding, and he was gelded a little bit later in life, around 6 to 8, so he still does have some stallion tendencies like biting and getting a little uncomfortable in uncertain situations. We like to inform the vet of this when they come to see Sunny because we don't want other people to be harmed or him to be harmed. So sometimes we will take him out of the cross ties and put him in a lead and halter, or we might even use twitches or restraints that we're going to be showing you today.
So for those who are unaware, Allie mentioned that Sunny is a gelded horse, which is a castrated male horse, meaning that Sunny is unable to produce offspring. Allie also mentioned that he was castrated later in life. And this does mean that he still exhibits some stallion-like tendencies as he was exposed to testosterone for a longer portion of his life. And so that is just something we like to make the vet aware of. It's not normally a problem, but in case it is, we like for them to know. Allie also mentioned that we're going to be showing you some different types of restraints. And some of the most common restraints when it comes to horses or larger animals are twitches. Now, these are mechanical twitches. Basically, that just means that you use a tool or mechanism to twitch the horse. Now, we have several different types of twitches here today. They all serve a similar function and are used in the same manner. This here is a PVC twitch, meaning there's a PVC pipe for the handle and a simple rope piece for the nose portion of this twitch. We commonly use this twitch as it has a little bit of a easier handle to apply, and the nose portion is easier to get on and off the horse in a fast manner. However, if we're doing things like bathing the horse and we need to apply a twitch to bathe the ears or the head area of the horse, this one is sometimes difficult as it is slippery when in a bath stall type situation. This is a secondary type of twitch, and it is used in the same manner as the previous one. You'll note that this one has a wood handle and a chain portion for the nose, and this is not necessarily more or less humane than the previous twitch. When you apply the chain portion, it doesn't really twist in the way you would think it would to pinch the horse's nose, and it acts in a similar function as the rope. This is possibly the most common type of twitch that we use here on our farm. It has a wood handle and a rope portion for the nose piece. And this is a slightly longer twitch when compared to the others. And so it has some better amount of tension that you are able to apply to the animal to give you a slightly better grip. I will say, however, that this nose portion on the twitch is slightly shorter compared to our others. This does mean that it can take some more time to apply or take off of the horse. So if we're trying to have the vet in and out pretty quick, sometimes it's not our go-to choice. Today, I'm going to be demonstrating with the PVC twitch. Now, in this scenario, both Allie and I would kind of be serving as vet techs, or possibly Allie would be the owner and I would be the vet tech applying the twitch. You could use a twitch in a multitude of different scenarios. However, it's common when an individual or vet is giving injections to the horse. You want to make sure that they are not hauled at or they don't get bitten by the horse, so it's easier to put them under a twitch. Now, the twitch causes the horse to release endorphins to the brain, and that kind of overrides any pain that they may be feeling during the procedure. However, you should not be using a twitch in a scenario when you need to use sedatives. It does not override that use. But you can use it for many small procedures that you would have that you can be used on a vet call. So, Allie's going to hold Sunny. Now, we did take him out of the cross ties for this. As we mentioned earlier, Sunny has a tendency to lay back in the cross ties and he will end up breaking them. So, Allie, as the owner, is aware of that, and she's going to hold Sunny and get him in a position that is easy for the vet tech or vet to apply the twitch. When applying the twitch, you kind of want to start just by rubbing his forehead and working your way down to the muzzle area. You're going to grab his upper lip. As you can see, he's going to show it off for us. And I'm going to take my left hand and run the loop over his upper lip. I'm then going to work to secure the twitch. You simply twist it. Once I get it tight enough, I can hold him just like that. Now, you do not want to over tighten the twitch. You just want to make sure that as you're holding him, you want to make sure that this area of his lip does not lose color. So again, we're checking kind of for that gum color. We want to make sure it stays that pink color. If it starts turning blue, or purple, you should release the twitch. And he should not be twitched for more than 10 to 15 minutes at a time. Really, anything over than that, your horse is going to start to get aggravated and potentially aggressive. So when I'm working with the twitch, like I said, if our vet is giving injections on Allie's side, I'm going to pull him over towards me, and so his face is away from the vet. He cannot bite them, and Allie can also kind of work to block him if he moves to bite the vet. He did a very good job for that twitch. All the other twitches can be applied in the same manner. I do have a secondary type of twitch. It does not have that rope or chain portion to the top, and it's actually broken. So we won't be showing how to apply it today, but it's almost like a clamp. You can open it here at the bottom, you put this portion over the horse's nose, and then it can be closed. It's sometimes referred to as a humane twitch, and it is seen that way as you can step away from the twitch and you cannot over tighten it. Allie is now going to show us some of the ways in which you can do a manual twitch or manual restraint or hold on the animal. She's going to start off with an ear twitch, and this is done by simply grabbing the base of the ear. You do not want to grab the top of the ear, seeing as there are more nerve endings there, but you can grab the base of the ear and not risk damaging the ear. You don't really want to tug or pull on the ear. You're simply applying pressure as to take the horse's mind off what other pain may be associated with their procedure, or simply if they don't like where the vet is standing, if they're standing near their face and they're a little bit head shy, you could apply the ear twitch quickly and easily to prevent the horse from acting out. Allie can now move on to she's going to do a leg lift. So it's simply what it sounds like. She's going to lift up the leg, and this prevents movement. So Sonny, it's really difficult. He does not walk on his two back legs. Be pretty cool if he did, but he does not go anywhere like that. So if Allie's performing a leg lift, then our horse is not going to be moving from side to side. Maybe the vet has to look at injury on another leg. This can prevent him or her, the vet, from getting kicked or injured in the process. This shouldn't be done for an overly long amount of time, no more than 10 minutes, as that could prevent blood flow from circulating properly. Allie can now move on to a skin pull. She's just going to kind of find that crease in its shoulder, and she's going to pull on some loose skin. He may be standing in a weird position, but there we go. She can kind of find some skin up towards here in the neck. And all she's going to do, she's going to take that skin and kind of roll it between her fingers. Sonny is well fed. It's sometimes difficult to find loose skin on him. But see, she's just going to kind of roll that skin between her fingers. And as she does so, once again, she's just taking his mind off of whatever may be happening or what the vet needs to do. This is commonly done by vets when they're getting ready to give injections, as it kind of is a really quick way for them to take the pressure off of the point in which they're applying the injection. And those are just some really simple, quick, easy ways to restrain a horse or other large equine when you're attempting to do veterinary work. We are now going to go and model some other forms of restraint on a younger horse. We have a foal. He's about 3 months old, Roosevelt, and we're going to show some different ways that you can restrain him. Hello everyone, we are back here with Roosevelt. As I mentioned earlier, Roosevelt is a little under 3 months old. So right now we just kind of pulled him in from his field, and his mom's in another stall. So he's a little antsy right now, and you're going to hear a mayor in the background who's calling for him. But today we just wanted to show some of the ways in which you can restrain a foal. A lot of people think of foals as really cute and cuddly, and they are. However, when foals are born, they weigh approximately 8 to 10% of their mother's body weight. So if you have a standard 1,000-pound horse or mare, that foal can be around 80 to 100 pounds when it's hitting the ground on the day it's born. And so Roosevelt here, he's a pretty good, well-mannered foal. However, you can see he doesn't really like me holding him right now. He can't get to his mom, and he's not really where he wants to be. And so that's something you have to be mindful of. And you're actually going to restrain him in a very similar way in which you could some of our dogs or other animals. However, he's just much larger and stronger. So when I get him, you'll notice I am utilizing this corner and this other wall. It takes some of the work off of me because he is a pretty stout young foal, and he could walk me around if he wants me to. So I'm going to put him in this corner. If our vet is giving some injections, what I can do is I'm actually going to try to come off this wall because ultimately I do not want to be squished on the wall. So I can take him off the wall. I'm going to get away from it some. And if he wants to put his butt on that wall, that's okay with me. But I'm going to kind of try to get his head towards me. And so then right there, his neck is available for some different injections. When he was a foal, he did have to have some plasma transfusions, which is a fairly common thing with foals. But that did mean that just a few days or hours after he was born, he had to have injections and he had to have blood pulled. So it is important though, like if something like that happens and he does get away from me, I'm able to kind of get him back to where he needs to be. And you just kind of want to be calm when working with foals, because if you get all nervous and flustered, they're going to do the same, and then it's a whole big mess. Earlier when we brought him in, he figured out pretty quick that this is a half stall, meaning it's not a full front wall, and so he tried to jump the stall. And so that's just something, when you're working as a vet tech or in a veterinary position, you are aware of. Just be mindful that when you're working with young foals, things can get out of hand. You want to restrain the animal by pulling them towards your body and often having them in a curved or flexed position, so it is more difficult for them to gain the upper hand or advantage over the handler. It is also best if you have multiple individuals that can help you or assist in restraining the animal, as to prevent things from getting out of hand and potentially injuring either you or the animal. We're back here with Sunny, and we just wanted to share with you the multiple ways in which you can properly restrain an equine or large animal for assistance in veterinary procedures.